So the title of the talk is How to Gain Clinical Experience and Shadowing. And basically, this is the 64, I call it the $64,000 question that most pre-meds and pre-PA students go through. And it could be also for, other things that you want to do. And so going to run through um, some things. This is a disclaimer. I'm not receiving any funding or um, programs that I'm stating. It's my opinion and experience working in healthcare for about 10 years. Experience running programs and interacting with academic medical center and admission people. Just like any information you receive in life, do not accept it as face value, but research it. And I reference to mostly California. It's because what I know, but California tends to be stricter for most things compared to other states, and I think the ones that are comparable to it are, um, in terms of Illinois and New York, tend to have a little bit as strict. Either some things are stricter or as strict as California, and so um, if you ask me a question from other states, I may have knowledge, but I wouldn't consider myself to be expert at it. But I'll try to answer as many questions as I can. And I'll do, and so please put your questions in the Q&A and I will try to answer them either at the end or in the middle of it. So I keep my eye on that as well. Um, so this is a difference between experiences, and I think this is really important, and this is how I'm going to talk about it in here. Healthcare experience is basically when you are in a healthcare setting, you're volunteering, you're observing, shadowing, you're not touching patients, and I'm going to talk a little bit about that, or providing care. And that's very um, defined in that role. And patient care experience, sometimes you may hear direct care experience for like PAs, is you're providing direct care to patients. You're touching them, manipulating them, taking their blood pressure, poking them for blood draws and other things. And for any of those things, you have to be certified or licensed and follow standard of care. And there's a responsibility and a legal liability for that. So, for example, this happened a few years ago where a police department hired a phlebotomist to go do the blood draw on um, on people that were being arrested for DUIs for their blood draws and so blood alcohol level, and that person was not licensed, and so they ended up getting few hundred assault charges against them because it is considered assault providing care that if you're not licensed. And so a word on shadowing. Um, Shadowing is not patient care experience. It is a passive healthcare experience, and it's a good start. But anything more than a few hours, you know, it gets pretty much the same. Things are not going to change, and so um, it's a good way to start. It's a good way to see um, different healthcare settings, like from a clinic to the operating room to the ER, um, and so however long you need to figure out if this is a career for you. Um, Being useful for investment and knowing if this is the right path for you. And so you're going to be spending all this time studying and going, but then you go to medical school and you realize that, like, you know, patient vomit or blood makes me sick and I can't take it, or any other thing. And so this is a really good entry point for you to know if this is what you want to do. And whatever you do, do not pay for clinical experience. There's places out there that say, "Oh, will give us, for 100 hours, you could pay us, $1,000 to get clinical experience," and don't do that. And I'm pretty like And so I'm pretty like vociferously against that. And this is just an overview. Patient care in California and in the U.S. in general is that healthcare is the most regulated entity in the U.S. You have facilities that are hospital, clinics, doctors' offices, and they're licensed by state, county, and federal. And so there's a lot of rules and things that for these things to stay open. Litigation from errors, but also strong law enforcement. And so if you break a law, there's huge ramification for that. And basically, people's lives are in your hand. And so, would you want someone to take care of your loved one if they're not recognized um, or recognized or certified to do that? And so that's a really big thing is that a lot of pre-meds are, want to get into the hospital and gown up and help with surgeries. It's like, well, that's cool, but would you want that done if your mom is under? And so you just have to be always really careful with that. And there's a saying, do unto others and to do yourself. And so just always think about that. Understand scope of practice and don't cross it. And so, if you are, for example, an EMT, please don't do on the TV shows they do thoracotomies in the back of the ambulance. That's actually a really good way to be charged with felony because you're not qualified or certified to take a scalpel to someone's chest. And so, please don't watch Hollywood as a barometer. And this is the saying is always stay in your lane. And so if you're an EMT or whatever you are, stay within that scope. And those scopes are very defined. There's no gray area. Um, so there's legal issues in healthcare in the US and privacy rights for patients. You can't let anyone in the hospital and healthcare setting without clearance. And that means you need to be background checked. And this is pretty much most of the US. You need to be background checked. You also need to be cleared, health wise so that, you don't have TB or COVID, uh, hepatitis, or anything else to, um, to expose other patients to it. Uh, but also HIPAA, it's called the House Insurance Portability and Patient Act, is that you need to basically follow those rules. You can't look at any of those things, and it's a 5 years in jail and 250,000. And you could go read more about that, about what HIPAA is. And patient safety, people who touch patients are trained and qualified, meaning taking a course, passing a test to be qualified. And the main question is, will the patients be safe uh, with this person? Now, volunteering is safe if you go into a hospital or usually big hospitals. You become a volunteer, like in the ER or in PEDS, is that you're covered by insurance if you're hurt, and they can defend and protect you. And so, let's say you are volunteering and something falls on your head, like their insurance will cover you. But also, if there's any issues, like if you're within your scope, they will protect you and they want to make sure everyone is safe. So, paid versus unpaid for medical school. And this is kind of the thing is with PAs, you have to have thousands of hours to apply to those programs. And so this is mainly for medical school. And so paid versus unpaid. And so paid is basically you are responsible and liable. You are accountable for someone that's above you, so usually a supervisor or manager. You're certified or licensed. You are a professional. That means that it shows to the admission committee or wherever you are is that hey, they depend on you, and then you could be fired. So there you have liability and accountability, and so uh, paid is a great thing to do. Unpaid is you have flexibility and so, you could go in when you want. They can't force you to do that. Although, if they're dependent on you, it's a really bad, I say it's bad juju if you don't show up or flake on them. You have the freedom to take time off, um, like to study for exams or other things. It's low stress and low responsibility, and so if nobody's paying you, they really can't have any responsibilities for you unless you choose, and then you could be choosy in what you want to do. And so, and then paid, what's pro and con to it. And the pro is that you're making money, and now healthcare is probably one of the best paying jobs for a lot of people. And so, that's there. You have shown responsibility, and so that means that you're a responsible person. You've gone through a selection process, so that they had to go through an interview and hire you, and then you're taking care of filling out an application, and you're making money as well. So the cons of it is that if somebody's paying you, that means that they want you to be responsible to them. You have to be certified. You have to go through some sort of training, orientation, and some of those trainings may cost you some money, an investment. You have to answer to a boss, and so and your boss really is not going to care that if you have to take an OCAM exam, or other things that you have to do. You have to deal with rules and policies. Somebody asked, yes, I'm going to put the PowerPoint in the chat at the end of this, and so you could download it. So, yeah, sorry, I should have mentioned that earlier. Um, and you have to deal with policies and rules, and it's mandatory work. And so, if you're working in a critical setting like ER, ambulance, or other things, if there's a disaster, you have to kind of show up. Or if there's shortage, you have no, you have not a lot of options. And so just be wary of that. I work in the ER, and so when I work there in the beginning of every semester, I tell my professors, "Hey, just want to give you a heads up. I work this place. I'm an essential worker, and if and I work for a county, and so if there's a disaster, I'm a mandated, and so I have to show up." And so they understand. And uh, through all this time, during COVID, it only happened twice, and both my instructors were very, very kind, and didn't really, you know, make count that against me. And part of your job is to do certain things, and so yeah, you have to deal with contagious patients, and you have to deal with combative patients. And so you may get hurt at your job, or you may get pink eye, or something that is gonna um, and those are the risks that you will take as working in healthcare, going into medicine, nursing, or anything that you do. Is That's a risk that happens. And um, so just be aware of that. Sorry, okay, sorry. And unpaid is, when you're the nice thing about not being paid is you can be flexible. There's no pressure or responsibility. They can't really fire you. Um, you know, and you don't have to do things you're not comfortable with doing. And so, if you're, um, if you're a volunteer, they're not going to ask you to go in and give a blanket to some patient that has TB, active TB, or COVID, or anything else. And so, and you could take time off for your OCAM exam. So you could basically say, you know what, today I'm just not going to go. I'm going to study for my exam, or hang out with your friends and parties and all the other good things that people do. And and then again, you're around doctors and patients, um, um, patients that, and it gives you that access. The cons of it is you're not gonna get a full patient care experience. Um, you can be asked not to come in, so they may not be able to fire you, and firing you requires certain steps that they have to take. But if you're an unpaid person, they're just like, don't show up, you know, and you're not counted and depended on. And so that's part of it. And then you can be part of this tribe. And I think that I would say, like, if you're in healthcare, if you're in, uh, we have this tribe and these codes and the way we talk to each other. And so, um, so yeah. So this is some myths. about medical schools that want only volunteer experience, and that is the biggest talk out there that they people are telling you to do. Unless you're from a wealthy family, you have to pay bills, and so you have to pay housing, food, transportation, books, and schools, and all those things. And so, if you have to, no point of doing free work unless you can do it. But also, if you can get paid and gain those, clinical experiences, do it. Patient care experience requires to be certified or licensed, and again, you're accountable to a state board, to any of those things. And so, and basically, it shows on your application that you are getting paid. That means that an institution, has put faith and responsibility for you to provide direct patient care. You have a boss or an institution that you're accountable to. You went through a selection process of best candidates to be hired for that position. You have gone through orientation and those rules and regulations, which all of those things you have to do as a medical student and as a physician. You are dependable, show up on time, can follow rules and regulations, work in team atmospheres, and good in order, and, to keep your job. And so if you were someone that was not dependable or hostile, they probably would not be working. And, again, all of us need to work and survive. And if you're killing two birds with one stone, then hey, more power to you. But also, you make a lot more money too. Like if you work at Starbucks, you're making, $15 an hour, where, in healthcare setting, you could make 25 bucks an hour. And so um, these are some things you should know about healthcare. Now, even though COVID is pretty much over, there's still lingering um, times and so just know that a lot of people in healthcare are burned out right now. And so, if you're going to volunteer, go into this, just know that there's a lot of people that have still remnants of COVID is still around, and patient care is not about you. And so, um, it's patient care. It's a business, is other people's jobs, and then families and patients that you're taking care of. And so, you're not the center of attention. When you're volunteering or shadowing or anything like that. And this is something that a lot of people just literally go off board, and is using your cell phone during your volunteer or shadowing experience. And these things, yes, we're all used to them. We take notes, we do voice recording, we do hundreds of things, but do not take that into a healthcare setting. Pull out your phone and start taking notes or whatever, or searching something you don't know. You got to be old school. Take one of these, um, these little notepads with you in your pocket. You can put it in your shirt pocket, in your back pocket, or hold it in your hand with a pen and take notes and those types of things. And the reason is patient privacy is huge. Talked about HIPAA, all of these other things that are out there. And so you may get tempted to take out a picture, take out your phone and take a picture. And that literally will throw people off the edge if you're not an employee. Now, some of you say, oh, well, I go into the ER, or I volunteer there, and I see people have their phones and other things. Yes, those people are physicians, nurses, techs. We all have cell phones. All of us use it at work, and all of us know what we can and can't do. And so, and again, these people are hired, they're employees, they know the rules. You're a guest in that area. And so when you start taking out your phone, and I get it, like some of you want to put on a pair of scrubs and go inside of a hospital or whatever and take a picture to post it on your social media for your friends or even for your own motivation. And that is absolutely fine. If you want to do that, do it, but don't do it around other people or around patients and things. and you could also lose your volunteer experience or your job. And I have a link in here that actually a nurse was fired because she posted a picture of a bloodied trauma room on her Instagram, and bosses found out and they ended up firing her. And so there is huge things for that. There's also a story years ago when Michael Jackson died and went to UCLA Medical Center. A couple people posted it and they ended up also being fired for that. So don't do it. And I know it's really tempting and we do everything on our phones, but don't do it. Things you should know about healthcare settings. Again, you're a guest and you're joining a tribe, people that are getting paid to be there, people that are into that. And so, and basically healthcare is everyone is important and plays a role, and you may not know all those roles. So, and be respectful of others. Don't say, oh, it's just a nurse. I'm only going to listen to the doctor, which is like a really good way to tick everybody off, and they would ask you to leave. Everyone plays a role and you don't know who's who. Don't get in their way. Don't be rude. Just remember you're a guest. Um, and they basically, doctors are, the healthcare team, nurses, techs, patient care technicians, they're all gatekeepers to doctors. And so just know that, they directly work with these people, and if they know you're interested and you're kind and respectful to them, and it's a human behavior, they will, do this. And so like in my own thing is, and I'll talk a little bit more about that as well. Um, but there's also people will test you, and so when I have volunteers come into our yard, tell them, hey, your job is to make sure this blanket warmer um, is full, so you have to put blankets in there so it's warm, and it's a test, and I want these to be full, and that person's there for 4 hours, and I check in there and it's always full. It's like, hey, this person's dependable. And so then I would say, okay, hey, there's a cool case going on in, room six. Uh, go check it out. And I'll literally walk him in there and tell them, hey, this person's here to observe because they pass those tests. And so I have other ones that show up and disappear and they come back and they want me to sign their form and I do it because I don't really care. I'll sign that you've been here for 4 hours and you could go sit in the cafeteria the whole time. Um, and so just know that this is a very hierarchical, thing that happens, but also people know that, hey, there's people coming in and they want to learn and they want to experience, and certainly a teaching hospital. And again, if you're volunteering, it's not about you, it's about all those other people that are there, patients, families, and you're not the center of the universe. So this is something that, I've seen volunteers do is they interrupt in the middle of a case or something that's going on to ask questions, and that's not a really good setting to do that. And so just have that in the back of your mind. And so things that you should get right now, if you really want to go into any kind of healthcare setting, comfortable shoes that are broken in. And this is, you would be surprised how many people don't do this. Show up as volunteers with brand new shoes that are really nice. So your feet get really tired fast. And so do that. Pen and paper. Again, have always one of these with you, paper, notepad and pen, and show up on time. So if somebody says, hey, come and shadow me at 7 a.m. or come and volunteer at 4 p.m., show up 30 minutes early. That means, that means that you have to get dressed, you have to drive or take transportation, but show up 30 minutes before. There's a saying is uh, if you're if you're on time, you're late. If you are early, you're on time, and if you're late, you're gone. And so this is one of those things, at least 30 minutes, minimum 15 minutes, but I would say put that 30-minute buffer into it. And the reason why is you don't know things are going to happen. People show up early, people show up late. I had someone who wanted to shadow a surgeon, and so I told them they're going to start their rounds at 7 a.m. to this place. This person showed up at 7:05. They were gone, and there's no way they could track that person. So this person texted me and said, "Hey," and I was like, "Hey, I'm not going to go track these people. I told you to show up at 7. Be there by 7, but that means you show up at 6:30 because people show up early, and so, anyways, um, get your CPR card and first aid, and make sure you get the CPR card that is for American Healthcare, the American Heart Association, BLS for healthcare providers, and that's kind of the gold standard. And I know the Red Cross does a CPR course and first aid, but um, it's not recognized by hospitals, and so make sure you do that. And the other thing is, if you become one, you could also become an instructor and get paid teaching it. And a lot of people do that as well. And so, if you're trying to find this, and this is something I've done in this presentation, um, is that I've just put these words that you could look into Google and find those things that are closer to you. And so, this is just a little thing in San Francisco, it's close to me, and you could pull it up and find, those things that are available to you. And make sure your vaccines are up to date. COVID, you know, MMR, all of those things that are available. Because every time you walk into a hospital, they're going to ask you for your vaccine record, and it's not COVID. Um, um, yes, so BLS certification is the same thing as CPR certification, but there is a specific one. It's called BLS for healthcare providers. So it's a CPR that is for people that work in hospitals. Sorry. Make sure your vaccines are updated. And I know there's people that are anti-vax and whatever, and this is not a debate that most places are going to have with you. Either you have it or you don't. And certainly if you're volunteering or those types of things, even though in the current climate and setting, uh, still hospitals require you to have that vaccine. And so, um, anyway, so I'm not going to talk more about that. Just make sure you have that. And I can tell you that the CDC vaccination record is not accurate, and I'll probably take that down in the future. But as it is today, hospitals are still going by the old guidelines. Um, Taking a personal inventory, and so I would say, ask yourself, what do you bring to the table that can be beneficial? If you speak a foreign language, if you're in California or in the West, Spanish is a big one. So if you speak Spanish, you are an asset to any organization that you join. But also in your community, like Sacramento has a big Ukrainian and Russian population, and Fremont Urdu is probably spoken more than English. So if you're in those communities and you're from those communities, definitely use that and say, hey, I'm fluent in Ukrainian and Russian, and a lot of places that need those are there. Computer skills, you're better at being on the screen than most 58-year-olds. That's just, some people, all of us have grown up with that. And um, so there's a lot of things you could do: webbing, web design, coding. A lot of the small practices know that, and social media. Now we're seeing more and more physicians being on social media. And so if you're volunteering at a clinic or shadowing a physician, offer to be their social media person. And that's something that you can do, and you're a lot more savvier than them uh, with using social media. And so um, yeah, I'm gonna get to every question, guys. And so if I see something coming through, I'll pull it up, but I'll go through every single one of them. And so there's this big community college dilemma. A lot of students say, oh, I can't really do any clinical experience because there is no student-run clinics here. And so I can't do this. I'm just going to wait until I transfer. And and so there's not a lot of pre-med opportunities. And you could be one of those people and say, oh, woe is me. I'm just going to wait until I transfer. And um, there's not a lot of pre-meds at your community college, and yeah, and so basically you can say, hey, I'm just going to wait until I transfer. And so that is a really, I would say that's a really bad thing to do. And the reason why is um, when you transfer to a transfer school, there's a lot of competition. So, for example, UC Davis has something like 6,000 pre-meds, and with pre-PAs and nursing and all those other things, you're looking close to about 9 to 10,000. I think UCLA alone has 15,000 pre-meds, and so you are all concentrated in this very small area, and you're competing for resources and opportunities. So, and so, uh, so this is something you have to do that. And so, don't waste your first 2 or 3 years. And so one of the other thing is that when you are transferring as a junior, you're going to have freshmen and sophomores that have put in their time with these organizations and entities that have done PR, fundraisings, and they're part of this community. And finally, their junior year, they're going to start getting, you know, student-run clinics and those other things. And so you're basically going to be at a huge disadvantage. And I've heard a lot of people that have transferred and had no clinical experience and they want to get into the student-run clinic and they don't do it until the summer at the end towards the end of their senior year. And so they've basically lost these 2 years. And the other part of it too is, guys, when you transfer to UC and CSU, they want you to go to school full time, which is an average 16 units. So at UCLA, if you're not done within those 2 years, they're gonna try to, you can't just continue. They were just gonna say, well, if you're not done, you're not done. And so know that. And then the other thing is that both, clinical experience, research, taking the MCAT, keeping your grades up, joining clubs and meeting friends. You have to do all of those things in 2 years. And I would say it's 168 hours in a week. And so hopefully you're sleeping at least 6 hours a day, which is about 40 hours of those are gone for sleeping. And, maybe 5 to 6 hours a week taking showers and doing grooming and all these other stuff. So know that, if you could get those things while you're at community college, that's great. This is also a community college as a strength is that you are in your own community. You know the area, you know where the clinics are, you know where the disparities are. You have a better feel of that community than someone who comes there just 20 minutes ago. And also on average, a lot of pre-med students are about 3 years at a community college. And so you have a lot of time and community colleges in California train more nurses, EMT, respiratory therapists, radiology tech, dental hygienists, and community health workers, and anywhere else, any other entity out there. And then you could also do it cheaply. And so, with only a few units, you could get some sort of certification or license. And it's not going to take a lot of time away from you. You have priority registration. You don't have to re-enroll as a new student and get into that one class that you need to do. And so some of those trainings are 3 units you could do. A lot of them are on the weekends. Um, and you already know the facility and you engage in that community and you already know the facility. You know where the EMT class is going to be. So you don't need to go to a new place and find out. And and you're serving your own community. And there's a saying is if you stay you're engaged in that community, you're gonna come back and practice there. And so there is a lot of physicians and groups and things that have a vested interest in that. And so um, you know, you know, again and again, you're going into your community and you're in that community versus once you transfer and you all want to go into this rush into this hospital that's there. And somebody says 2 years at a community college is too short for all those things. You're absolutely right. That's why most pre-meds spend about 3 years now at a community college to just do everything. And so, but yeah, it's true. But I would say, and there's also another private training centers, and again, I just always say be careful because not all private uh, training centers are created equal. Make sure you do your research, make sure they're recognized by the state. And so, and you could look at the state and national entities to see if they're certified and they're a training center. And you're basically paying for speed and and so the more money you pay, the faster you get done. And there's some EMT programs that you can basically um, do become an EMT in 2.5 weeks. And people are like, oh my gosh, that's like a lot. And it's like, well, if you take an organic chemistry, bio, all of those classes, it's easy. It's not that hard. And you could do it if you're taking general chemistry, OChem, all of those classes. It would be a very easy thing for you. And some of them just cost way too much. And that may be the only option. Um, and so basically, you know, like for example, like phlebotomy, some community colleges offer it, um, but I would say like there some of those trainings are very that you could only do it at a training site and not at the local community college. And some of them are less than $3,000, and you're gonna have to, and I would just say you make the call, say if this is gonna cost $3,000, how many hours do I have to work as an EMT to pay that off? And so, or phlebotomy or whatever else. And this is always say you got to do some hustling. And so, let's say there's a training center that you're like, hey, I really want to do this, but I can't afford it. How can I volunteer in your office hour or pay this off? Can I get a group discount if I get 5 of my friends to show up? Can we get a 10% discount? And also offer to come back as an instructor if and that's one of the ways you could pay that. So, um, and somebody is asking me if I'm working on my prerequisite for medical school or community college, is there time limit so I get everything done? For example, if you take a little bit longer to complete everything, does it count against you? And no, it does not, because like I said, um, at community college, there's no pressure for you to do that. Now, community medical schools will say, you need to have recency, but average person takes them 5 years to get their bachelor's, and if you're taking a little bit more than at a community college, yeah, people work, people have families, all of those things. So they're not going to come back and say, oh, you were at community college for 3 years or 4 years. I would just say there's this program called California Medicine, and they are aligned with community colleges to medical schools, and in their timing, they have 3 years of because it's really hard to take 20 to take all your lower division classes. You're looking at 20 units, and it's just not humanly possible. You, I think this is something that I always tell people is do not take more than 2 science courses a semester because it's just too much, and you're gonna have to do working and all of those other things. And so it's a, so yeah. So I'm not gonna talk about that. Um, oops, sorry. So volunteer in the ER hospital. It's pretty easy to do. You just basically, every hospital has a volunteer office, and you go sign up, and you have to again put in your vaccines and get clearance, and then you're in basically, and they give you this little shiny badge, and you could walk in, and you use it as a stepping stone. I'm sorry, I have really sore throat and my mouth gets really dry, so I'm really sorry that I have to take sips. Um, so I would say this is a really good stepping stone, and you can start. Now, this is this is something that I always tell people, be smart about this. Go to the local, smaller community hospital rather than the big teaching medical center for a couple of reasons. For example, in LA, if you go to UCLA Medical Center, it's huge. There's teaching hospital, there's medical students, there's premeds, there's everybody that wants to go in there. But if you go to, let's say, Sentinel Hospital, or there's a Dignity Health in downtown. I forgot the name of it, but anyways, um, that is less people that are in there, and so look at the smaller local community hospital than the big, medical center. Um, be respectful and always be listening and always have your head on you know, looking things around because you don't know if things come and may hit you, but also be respectful, to nurses, to techs, or other those things because they're the gatekeepers to the doctor, to the physicians. And if you're rude to a nurse, I would tell you they will make your life so hard, and they also do have a power to kick you out. So uh, I've had volunteers come in there that are really rude to nurses and and staff, and it's a really good way for you to ask you not to come back. And you have to be perfect at the small things. And basically, I told you a little bit about earlier about the blanket test. There's also the glove box test. They'll say, hey, can you just make sure all the glove boxes are filled? And you go around and you check on them and, and you fill them up or put new boxes in there. And if somebody asks you to do that and you do it, it's like, great, this person is a team player. But if you don't do it, they're not going to come back and tell you anything. But they're like, hey, this person's a flake or just really, and they're not going to be invested. And I think it's human behavior. And so, and so just make sure you do that. Again, you're a guest and you want to fit in, and that's a really good way to fill. Translator, if you're fluent in a foreign language, and this is basically not just taking Spanish 1 in high school, um, but you understand medical terminology, that's a really good way to always put in there and say, "Hey, I'm fluent in this thing. It's my native language," and that's your superpower. And in California, we are required to have translation in all of the settings, and so we have AT&T. There was also these virtual iPads, and I hate using those. I can tell you this right now. Those things are so clunky and you get disconnected. It's just a pain in the behind to use, and they're also really expensive. So they charge you not only for setups but per minute. So it's just really expensive, and some smaller clinics can't afford it, just because that it's really expensive. FHQ, which is a federally health qualified clinics. There's almost every single community has one of those, and those are also a really great place to, volunteer as a translator, but also volunteer and observe and see. Hospitals have that, and then, contacting administrators and say, if you speak a very unique language, there's always a need for that. And you could volunteer, but you also can get paid. There is a lot of paid opportunities to do that. And there's certification courses at certain community colleges, and you're just gonna have to Google that, certified translator, and looking within your community, and you could find out if there's courses. And usually those courses, you just take you take a language test, and I know some hospitals have a special thing that you could do as well to be certified as a translator. I know a really good friend of mine who's now a physician. She is fluent in Spanish. She's from Colombia, and she said basically her thing was that she went there to the translation office and said, "Hey, I'm fluent in Spanish, and can I help?" And basically, one of the people sat down and talked to her for like 2 minutes, and like, "Yep, you're good. You speak Spanish. You're good." And so that's maybe just as fast as you're certified and you're good to go. And they ended up paying her, and she ended up doing that all through undergrad and was getting paid. Um, Medical scribing. there's a thing for it. I would just tell you that it's fine. It's a great experience. It's not considered clinical experience because again, you're not touching patients and you're not doing that. There's a website you could look at, Medical Scribe Institute, and there's also Scribe America, which is like one of the largest one. And there's pros and cons to that. You could also Google medical scribe, city or county that you're in. And one of the challenges is there's no certification that are needed, so there's no national or state thing that you could do to say that you're certified. And it's flexible. And the reason, and then the other thing is since there's not a certified thing, it's really underpaid. There's some flexibility to it, but also if you're a paid scribe, you're going to have to work with those certain doctors, and so your schedule is going to be fixed to their schedule. And they pay you for the training, so that's a really cool thing. The 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 con of it is that it's not considered patient experience, and we could make, the thing is that there's a debate, and I'm you know I'm just telling you that some places don't look at it as patient care experience. Certainly for PAs, they don't. They look at it healthcare experience. So just know that, and again, you don't know um, what certain places accept as patient care experience versus healthcare experience versus direct care experience. And so there's a little bit of ambiguity to it. It's low pay. Again, this is kind of it. I always say it's like if I'm going to put in my time, I'm going to maximize that. And also, if you're listening to this in a year or two, AI is really taking over scribing. I know, like Kaiser, for example, their physicians in clinic, they basically your iPhone, it's an app, and you walk into there and they turn it on, and that does that. And so I think within the next 5 to 6, 7 years, I don't think scribing is going to be around. And so, if you're listening to this next year on YouTube, you may say I'm wrong, and I may be wrong, but I know that there's a lot more places that are using AI for scribing. So, I've also heard some ERs of doing it as well. This is another place that this is a really good place to get into hospitals that you're getting paid. And so you get your CPBLS for healthcare provider, your CPR, and it's called patient transport orderly lifting patient escort. And basically, you only need to have a CPR to get in. The reason is, patients are getting larger and larger, and nurses are getting hurt, and there's not a lot of people, and so having 5 nurses, it drains resources. So they hired these patient escorts and lift teams that you basically have this pager and you go around the entire hospital. That you may take a patient from the ER to the floor, or patient from the floor to the CT, X-ray. And so it's a great hospital. Sometimes you get assigned with a nurse where you help them transport critical patients from one end of the hospital or another one. Um, it's a great opportunity. Basically, you get this badge and it fits you everywhere in the hospital. So let's say you're interested in surgery, you could show up after work and say, "Hey, I'm an escort, patient escort. Can I come and watch a case?" Or if you see a doctor there, you could talk to them. And the other part of it too is you need to be able to lift 50 pounds. And if you're, young and healthy, you're gonna have to do that. And most people can. And you could also do it part time, which is a great thing. And so I know like a couple of people that work at nights that are students, and it's a great experience. And so again, if you um, look at it, there's patient transport, hospital. Make sure you don't mix it up with van transport, which is a little bit different, and you need to get a special license. So don't look for van transport, but basically lift team, patient escort, city and hospital that are close to you. And you could look at their HR jobs and find out, if those positions are available. And I would say every single hospital has them. EMT, this is dear and near to my heart because I am an EMT, and so I'd say it's a great stepping stone. You get great learning skills, like taking patient history, patient exam, vital signs. You learn how to identify signs and symptoms. It's EMT training is almost at every community college in California, and I know most other states have it as well. And you need to have your BLS course and your emergency response. And I would just tell you that if you're taking OChem or bio, then the class is easy because it's a very you could do it, and I have absolute faith in that. And and I would say the only thing for EMP and EMT or any kind of medical training is the challenge for people that are really book smart is that you need to put those into action and dexterity. And so some folks have a little challenge, but it's something that a lot of people overcome. And a lot of schools not only required, but they like Hofstra, UNLV, and a couple other schools basically get in medical students within 2 weeks. They get you EMT training, and then they put you on ambulances, and you do that for a month to 6 weeks before medical school. And so they're seeing that there's a lot of so it, in those skills you will have some sort of heads up before compared to other people, and it's 168 hours, and you get 24 hours of it in the ambulance and 12 hours of it in the ER. You need to pass a test, and every state and license has um, requirements to be certified, and there's not an extra test. They just take your NRMT, EMT, and the certification that you completed that course to that county EMS office. And then you have to pass a background check and also have a clean driving record. And clean driving record means no DUIs or any of that, no DUIs or things like that, or reckless driving. But if you had a speeding ticket, it's fine. And there are three levels to it. There's the EMTB, there's AEMT or EMTA, which is an extra course that you do, which I have that. And it's just your scope of practice is expanded. There's also EMTP, which is a paramedic, and it's 8 months, and it's a full-time 8 months, and you need to be an EMT for at least a year on an ambulance. And I would say if you're a pre-med student, that's going to it's going to take 2 years away from your track. And so, but if that's something you want to do it. But like I said, you don't need to be a paramedic. You could get a lot of experience as an EMT. If you're not at a community college, there's, UCLA, and these are just two examples that I'm using, but you could Google it, and there's a lot of training centers that are out there. And make sure the certification and pass rate data is on those things. And so you could literally go on any the state website and figure out the training schools and also their pass rate for their exam. And what do you do as an EMT? It's designed for ambulance, and so you you basically get a job with an ambulance company. You do take 911 calls, but again, if you're this is something that I always throw this out to people. If you are someone who's into clinical experience, and if you're assigned with a paramedic as an EMT, you're driving. So try not to take 911 calls. Inter-facility transfers are the best way to get clinical experience because it's usually two EMTs, and you're transferring patients from like ER to Kaiser or from skilled nursing facility to the hospital, so or from a hospital to a skilled nursing facility. And also, there's also critical care transport, which is usually two EMTs and a nurse, sometimes a doctor, and you basically one drives and two of you are in the back and providing that. There's event medicine, like concerts, sports games, large events, which I love doing that. I do it with RockMed, and it's a great experience. Casinos also hire EMTs, and so if you have an Indian casino close by, in close by where you live. It's a great and it's a place you could go. Movie sets, that's a fun one to do. Emergency department, you could become an ER tech. You at least need a 1 year experience as an EMT. Have a phlebotomy license, which is, and I'll go a little bit about phlebotomy. And you need to have be an EKG 12 lead certified. Um, so these are just the opportunities I just went over a little bit. RockMed, this is COVID one. This is not around anymore. I'm trying to take that off. Let me take a note of that. Okay. RockMed, this is an organization that's very dear to my heart. I love it. It's volunteer, but you get to go to concerts and football games, and you're around doctors and PAs and nurses. It's a great learning environment. I actually learned how to deal with a lot of patients that are overdosing by volunteering at RockMed, and got to meet this really wonderful psychiatric nurse who really, over a couple of shows, really taught me on what to look for, and it was a really great learning experience. CrowdRx is another one. They do a lot of events nationwide, and I think they're affiliated with AMR. And that's a paid opportunity, CrowdRx. Patient care technicians, that's what it's called. ER tech, um, that's another name that it's called. And it's a longer course, but that you have to combine EMT or CNA. It's one or the other. In some places only hire EMTs, and some places only hire CNAs. Phlebotomy, you have to have a phlebotomy license in most places. You need to have a pretty good knowledge of medical terminology and EKGs. And there's not a national certification. And so, in some places, there's different combinations of jobs, and so there's different words that they use, and so just make sure when you're looking for jobs to because there's all these different terminologies, and I don't have all the terminologies. They change all the time. Phlebotomy is another thing that you could do just as a phlebotomist, and it's considered clinical experience because you actually have to talk to a patient and jab them with a needle, and you're doing hands-on stuff. Um, you basically draw blood in hospitals, labs, clinics, and also insurance companies. In California, you have to have 40 hours of classroom and 40 hours of lab time. And you basically, for 40 hours, you volunteer at a lab and you just draw blood. Again, it's a great place to start. It's a good foundation. Um, Also, insurance companies hire people to do life insurance, um, blood draws, and basically you get in your car and you get 100 to 150 bucks a person to draw their blood and send it to the lab. It's a great thing for gap year and wanting to do, and this is also one thing that's also happened is that um, if you want to do clinical research, a lot of places require you to draw blood on patients and you have to be certified. And so if you already have your phlebotomy license, it actually will give you a leg up on clinical research jobs that require lab because what ends up happening as a clinical researcher is if you're not phlebotomy certified, you need to have a nurse or someone else to draw blood and again hiring an extra person to do that. Or I know like in our ER when there's blood draws, the MRAP volunteer shows up with a thing and asks us to draw the blood for them and and give it to them. And so, you know, um, it also speeds up a lot of work. I know that some places that do research, they send patients to the lab from their office, and so that's one place you could be um, have a leg up on someone else that doesn't have it. There's also this is the phlebotomy training specialist. They're like the largest one in the country, and it's a little bit of money, but you could do it in a couple of days, 40 hours, which is usually a week or over several weekends. Certified nursing assistants, and this is something you do in hospice care, elder care, hospital, private homes, home health, memory care. you're basically providing basic care like bathing, turning patients over, wound care, eating, vital signs. Um, and California unfortunately has like the highest requirement, so you need to take a course for about 150 hours, and you need to be 16 years of age and you need to pass the exam. And each state has its own nuance, and so some places you could become a CNA in less than 40 hours, and it's a great experience. And like I said, it's a lot of people do that. A lot of pre-nursing students do it, and it's a great experience to get you in to do that. There's pros and cons again to anything that you do in life. Pros are that it can have flexible hours, like you could work a lot of nights. It's a great experience. There's a huge need for it. The cons of it, and again, this is my personal opinion, it's slow pace, and so I just couldn't do it. But God bless the people that can do it. It's just too slow for me. Um, and also, you're taking care of people that are in bad state, either they're terminal, um, and they're near death, and so that can be a uh, little hard. And then you're also lifting and turning people, which, again, if you're small or have back issues, probably not the best thing you could do, but and this is also how you could find program. Again, be careful. There's a lot of mom and pop shops that set up these programs that are not recognized by the state agency. And I know outside of California, a lot of Red Cross, American Red Cross, that is very um, recognized and reputable that has those training programs. And so, again, this is another thing that you can do. Medical assistant. Some places we have somebody who's Steve who actually couldn't make it today, but he basically became a medical assistant from a place that he was volunteering, and then they ended up hiring him, and he was not licensed. And I just told them, hey, go look at the licensing requirement. And basically, if you're working somewhere doing medical assisting, um, they pay you a lot less if you're not licensed, but it's a great place to get your foot in. And you just need to have a physician sign off on it, and you become licensed, and then they have to pay you more, which is a really good way to get in. And unfortunately, I was gonna have Steve come and tell this story, but he was busy today. Pros and cons: you work in a clinic, you are around physicians, you directly work with them, and it's not just primary care; it's orthopedics, I always forget the orthopedic, but dermatology, endocrinology, like any of the lodges, you know, that you could do that, uh, And then the con of it is that is the con of it is that it's office hours, so Monday through Friday, 8 to 5, and for most of us that are in school, much harder to do that job. There's another one you could do is you become a registered behavior technician. It's a 40 hour. You could do it online. You could take an exam, and then it's like $100 to do the training, and then and then the Autism Partnership Foundation has a free program that you could do, um, and do that. And somebody asked, do non-licensed MA still count as um, clinical experience? And sometimes they're just made to be office ad. I mean, again, this is one of those hard things, challenging things to do, is that how do you state it, you know? If you're only doing paperwork, then I would just say, hey, you're only doing paperwork as a medical assistant. But also, but also clinical experience is considered, if you're taking blood pressures, and that's considered clinical experience. And so if you're a non-licensed MA, become a licensed MA. I hope that answered that. Anyways, this is also another thing you could do. And basically, registered behavioral technicians, you work with folks that have autism, that are autistic, and it's a great experience. Again, if you're interested in psychiatry or mental health, this is a great experience. You could do that. Home health aid, this is also usually can. It's actually sorry. It's usually CNAs, medical assistants, um, or EMTs that become home health aid. You interact with patients. You are the only source of care, usually going to people's homes, following up, helping them with, bathing and other things. And it's a great experience. And I know some folks do it. Um, and you need to have a car to travel to people's homes or a way of transportation. Life Child Specialist Assistant, and again, this is like a 600-hour training to do that, and you need to have a BA or BS. And again, I don't know, 600 hours is a lot of hours to be certified in something, but it's another thing if you want to put in the time. Doulas. A lot of you that are interested in doing OBGYN, women's health, this is a great, great experience. And not a lot of people know that, but you could technically become a doula within 60 hours. And you're providing emotional support. It's a very quasi patient care because you are making sure, you can take blood pressure, you could see the woman, the mother, and making sure that you're there. California and other places are like hiring culturally relevant doulas. And they've found, like, for African American mothers, if you have an African American doula, the outcomes are a lot better. Also for Latino communities, if you speak that language, they have found great results. And I know like Sutter Health is hiring and training doulas, and they pay you for that training as well. So definitely look at it, Google it, doula training, Oakland or whatever. And also, if you have some experience, it's actually great pay, and some parents pay doulas $1,000 to $2,000 to be their doula, and that's not like $2,000 for the day of the birth. It's actually the time the mom is pregnant, and until they give birth, and so you know, and also it's a great experience. You build you bond with that family. But I just want to be very clear, you're not delivering the baby by yourself. Either midwives, nurse practitioners, or physicians are doing it. And so just want to put that out there that you're not going to be delivering babies. Nor should you. But anyways, but it's not flexible because babies don't deliver on a schedule around your school schedule or your OCAM exam. So again, this is one of those challenges. Um, Hospice care. I call these people angels because it's a really hard work to do, and you're providing support for patient and their families because every patient has someone who loves them. You may not be providing direct patient care. Some places have volunteers that basically show up and help with like gaming, food, another thing, another thing that you could do. But also, I know like there's like in-home hospice care where some folks go in, and if you have a caretaker, like let's say if someone is taking care of their loved one, you're going in there while they're taking a shower or going for, doing things that they need to do, and you're just, keeping an eye on that patient. Um, you comfort these people. Sometimes you read for them, you make phone calls for them. I know that someone that I know that they volunteered at a hospice care, and their job was basically go around with an and iPad and have people FaceTime their loved ones before death. And again, it's a really humbling experience that people could do that, you know, and so again, you could find hospice volunteer, hospice care city in Google. Community health workers. This is a really great experience. Huge need, and I could tell you, California, a lot of community colleges have those programs now. It's usually 2 to 4 classes. It's a great job. It pays really well. A lot of FHQ, which is the Federal Health Qualified uh, Health Clinics, and also rural health clinics need them. You're not providing clinical care, but you're providing mental and social support. You're following up with patient care. And some places pay you, like California, to become certified community health worker, which is a great job. Again, you learn a great deal. Sometimes you work with uh, public health and you follow up with their um, care. And so this is a really great experience as well. And one of the other things you could do it remotely too. And so some community health workers are done remotely or via Zoom. This is another one that is a great experience if you are interested with working with mental health. It's basically in every county, there's a hospital that does sexual assault um, responses, and they take the patient and they do a nurse will do the exam to make sure that they collect evidence. But you're there, you're providing the need. Some of them are volunteer, but a lot of them are now getting paid. And it's a great response to women, but also some men men do get sexually assaulted and children. And there's a greater need, obviously, for women and kids, um, because that's how our society is, unfortunately. And you basically get a pager and you're on call. And the other thing is, what's really amazing that if you could do this as a young person, if you're 18, 19, 20, unfortunately, a lot of the women that get sexually assaulted, are younger. And so it's much greater to see someone who's at their age group than someone who is in their 60s that they may not relate to each other. And so, and you're basically there with the patient while they go through the exam. Um, and then you provide resources for them and how to follow up. And you're providing supportive care. Sometimes you get to go with them when they're being interviewed by the police, and it's a it's a great experience. Um, in California, it's a 68-hour training, and some counties don't even have sexual assault crisis response, so they have to go to the nearby um, to do that as well. Another place that you could go. This is another one you could do. This is something you could do remotely at home. Crisis text online, and I put that information in there, and the training is free, but they ask you to make a 200-hour commitment to this. And I put this on there. Go look at it. And I know some people do this, and if you're really good with your thumb texting, or you could do it on your laptop. Great experience. Food insecurities, food banks. You could go at food banks and volunteer. Community garden programs, World Central Kitchen. It's an organization that I sometimes volunteer with. I like to cook, and so if there's like a disaster or need, I love to show up and chop, 100 pounds of onion. And so um, I've done that a couple times with fires and stuff. That even though I'm a healthcare person and I could do that a lot of times, someone's house burned down. If you could make them a hot meal, it's the best therapy for them. So I love this organization, and you don't need to be a cook. Usually work with cooks. Actually, one event that I did, one support that I did, Guy Fieri showed up, with his spiky hair and everything, and it was a great dude. Just talked to him a little bit. I'm not a big follower of his, but I thought that was pretty cool. And then there was another guy, Chef Andre, who came to another event that I did, so that was cool. Anyways, this is another one. If you're interested with children, this is a great experience, dear to my heart. This is something that I've done for years. You become a court-appointed special advocate, and basically each county has a chapter, and you are basically providing advocacy for minors that go through the healthcare system. You work with a judge, and you basically a judge basically you're assigned to a minor that's going through the court system, and the judge wants to hear directly from you, not through their lawyers, not through their family, not through anything. And so you get to spend a lot of time with that child, and you write reports and to the judge, and sometimes you may even call the judge or meet with them. It's a great learning experience. You learn and listen skills. You're supporting kids that are going through a difficult, traumatic time. And a lot of counties need this. It's all volunteer, but also this is something that's really important. You usually work with the same judges. And if you get a judge to write you a letter of recommendation for medical school or for a job, it's huge. It's a huge thing that you could do. And so this is just something I want to throw out there. I volunteer with this organization, and it's very dear to my heart. Red Cross disaster assistance teams this is another thing you could do. It's usually at the local level, but also national and international as well. And then you basically have a pager, or they page you on your you have a pager app. I'm sorry, it's a pager app, and you show up to a disaster, somebody's house is burned down, and you give them voucher for hotel, food, um, and those types of things. You could go national. So if you have a couple more classes, if there's a disaster somewhere, anywhere in the US or internationally, you could travel. They cover your travel. And sometimes they may pay you a little bit, but that's usually very, very rare. It's usually a staff person. But but I've done a little bit of the disaster assistant team, but then I signed up to be a national uh, volunteer and go out to disasters. And basically providing need for people at their lowest point of their life. And so um, could be flexible. You could be on call at night. It's 24/7. And there's a need for younger people to do this because some of the national disaster team, the regional disaster teams, a lot of old retired people, and God bless them, they're really helpful and stuff. But some of them can't get it to certain places. But but there's a great need for this, and so again, something you could look at. These are things that I think is too long, and I don't recommend. To become a certified medical assistant, some community colleges have. It's like a 2-year certification. Private places charge you like 15 grand for 8 months. And they also teach you billing and coding, which is like not the most funnest thing you could do. Surgical tech, again, this is a great experience, but you need to have some prereqs in anatomy, physiology, and it takes 1 year full time to become a surgical tech, including the hours and everything else. And then you provide, and it can be expensive. Um, this is another one. I call it tourism. Um, 2-week international trip. I think they're unethical. Again, if you can't provide certain kind of care in the US, but how come it is okay for you to go to a place that people are poor and non-white and provide that a lot of these cost money. They say, "Oh, give us $2,000 plus your flight plus everything else," and you go for 2 weeks and do that. There's a great article in the WAMC that writes about that and how schools view that. And again, get that with a grain of salt. And again, some of this is my personal opinion, but another thing you could do, citizenship classes, even though this is not clinically related, but this is something you could do as a human being, certainly with what's happening in our country today. Um, if you speak another language, do a citizenship class for people in your native language. You don't need, if you've taken any kind of poli-sci basic thing, you could teach those classes, and it's a great experience. I love doing this. If I had time, this is one of the favorite things I love to do. ACLU does it, community ethnic organizations. And this is again, if you're a citizen, your citizenship is not a right but a duty. And so if you can help people in your communities, in your languages, or even in other communities to become citizens, that to me is a thing. And so this is what I'm going to talk about shadowing, and this is towards the end of it. And I know it's kind of long, but sorry, but I try to be thorough. Um, Find a local doctor or practice. Look around your house, your school, where you're at. Again, going to those big places, anytime you go to a big facility, it has multiple layers for you to jump. But if it's a local practice, which those are becoming much harder to have, but local groups, make sure you find their full name and you spell it correctly. This is the worst thing you could do is if you take someone's name and you misspell it. You write one page. Basically, you find these places that you're at, you write a one page and you attach it to your resume and you drop it off at their office. I know phone calls is much easier, emailing is much easier, but I would tell you that most doctors hate checking their email and they don't check their emails. Most of the general emails are not checked by doctors. But if you write a letter addressed to the physician, it's going to get delivered to them. And so if you go to a practice and there's three doctors, write three names of those doctors and drop three letters. And you're mostly likely to see a staff person or a clinic manager and just ask for them and give that letter to them and say, this is letters for Dr. So and so. What you should have in this letter. Again, make sure it's not more than one page because they're not going to read anything longer than that. This is not your personal statement, but in one page, introduce yourself. Hey, my name is Jubin. I go to this school. This is my major, and I'm the president of my honor society. And I'm a first generation. I'm a first gen college student. I'm interested in becoming a doctor. Don't know anyone. There's a lack of access, and I want to become a physician, and I want to be able to see what you do and shadow you and experience that. And third paragraph, you should talk about the opportunity from going into medicine and when you're available. And so let's say that semester you're available Mondays and Wednesdays. Put that in there. Say I'm usually available Mondays and Wednesdays. Um, and I'm available to show up and do that. And then just being a professional. Again, when you show up, make sure you wear something nice. You don't need to wear a suit and tie, but you need to dress professionally. Don't show up with a, you know, Big Johnson t-shirt or F somebody. Just make sure you're professional when you show up to do that. And again, and I know emailing is easier, but your email is mostly not going to be read. But this is taking that express, and you have addressed this letter to someone to do that. Um, and then also in this letter, you thank them for this opportunity, put your contact information in there, and sign your name. Um, and then the other part of it is you get into this after a couple, if you showed up a couple hours, and say, hey, I'm pretty savvy in social media. Can I help your social media? Can I maybe do some videos of you or whatever? And if you also speak another language, put that in there and say, hey, I'm fluent in Spanish, I'm fluent in Vietnamese. Um, do that. And then also after, if you showed up long enough and say, hey, can I start working as a non-licensed medical assistant? And can you train me on the job? And again, these are all pending on you show up, you're professional, you're courteous, people like you, all of those things, then this is a good way for you to get in. This is really, really important, guys. Make sure you put your full name on your resume and letters and sign it. You know, I know like in my emails, I just put my first name, but in a professional letter, do that. Make sure your email is professional. Like this is not a joke, but make sure it's your first name, last name at Gmail or something like that. I sometimes I look through the emails of people that should sign up for our events, and I will tell you some of those emails are really inappropriate for you to be used professionally. And so you could have that funny email for your friends and family, but if you're doing anything professionally for medical school, for anything, make sure you have a professional email. Um, Make sure your voicemail, a lot of times they're going to call you. Your voicemail has your full name on it. Thank you for calling, you know, Jubin, last name, John Doe or whatever. Make sure it doesn't have a song. And I know that you want to be unique and be a unique person, but again, you're using your phone as your professional office line. So make sure it's professional if you're trying to get that. If after you're done that, whatever, do want to do that. Also, get help with your college and career center for your resume. And we have a resource center that's posted on there how to have resumes and what they should look like. E-shadowing. This was something done during COVID, not available. Don't pay for it. And I don't recommend it because now, and again, it comes down to saying you're going to have two people that are going to apply to medical school, same GPA, same MCAT score. One of them has 100 hours of in-person shadowing, and the other one has 100% e-shadowing. And I know that if you're living somewhere that's not close to a place, and I know that, and it's not fair, but the world is not fair. Neither is cancer and diabetes and those things. HIPAA training is required by federal law to do it. And I know like some of the smaller clinics may not have HIPAA training. And so you could be proactive and get your own HIPAA training for like $30. Yeah, I think you have to do an hour training and then you take a quiz and then you get the certification. But it's nationally recognized. And so this is something you could um, put your shadowing letter and say, hey, I'm HIPAA certified and I also have a CPR certified as well. All right, so questions. If you have quite more questions, you can email us here and they'll forward it to me. And sometimes I answer the general email, but usually it's becoming rare and rare. So now I'm going to go and answer all of your questions. If you have questions, put them in the Q&A and I will try to answer them as many as I can. So do you have, Medias is asking, do you have suggestions for non-trad or career changers to gain shadowing experience? I find that I tend to have few hours because many of us are also working full time. Additionally, they have part time for managing full time work in school. So yes, the problem with being older and having responsibilities and those things makes things much harder. But I would say, pardon me, what are your superpowers? If you're working full time, you have some sort of superpower that you are like working and you know and so I had like someone who was an accountant, a full-time accountant, and I was like, hey, just go to the same to this doctor's office and say, hey, and actually a plastic surgeon offered to do their books, at rate or and in and so that's something you could do. But I would say there's a lot of things you could do part-time that I had in the presentation, and a lot of them are flexible. The nice thing is if you are volunteering somewhere, they can't force you to go in to do anything. And so, um, but I hope that answered your question. All right. Does hospice care experience providing patient family support fall under patient care experience and direct care experience or healthcare experience? That is a hard thing because some hospice care, you're doing vital signs and weighing patients and looking for uh, bed sores and stuff like that. So that can fall under that. But if you're just doing hospice care, like providing gaming or feeding people and those types of things. So again, it's what you've done and what can people attest to what you've done. And so, let's say you've done 6 months of hospice care and you ask them to write you a letter of recommendation. In that letter, they're going to mention what you've done and not done. If you provide clinical experience, have them put in there. I would just say that hospice care usually is considered um, healthcare experience and not patient care experience. But, you know, um, I've called every private hospital and clinic in 60-mile radius, but hospitals do not want to take shadow, and then small clinics said no. Would you recommend reaching out again in a few months? I just went over this. Do the letter thing, address it to the physician, and try to do it that way. But yeah, you're gonna, this is not a one-to-one. That means that if you do a one thing, I would also not call. Calling is the worst thing you could do. First is they're really busy, they don't like answering phones, and they're just gonna tell you no. So if you show up, you know, do it. But 60 mile, that's a lot. But I would say, and also getting your BLS training and your HIPAA training. Uh, and yeah, you're gonna get more no's than yeses, but you just need that one yes. So do phlebotomist roles as clinical hours? Yes, phlebotomists do because you're providing, you're jabbing someone with a needle, and so it is considered clinical hours as well. Do you have any information about the medical reserves? I'm interested. Mandatory to show up each time. Yeah, so medical reserves are basically these things that you do in every county in case of a disaster. There's also search and rescue as well. And yeah, I mean, I would just say look at your local county because, there's something like 4,500 counties in the US, and I don't know what every county does. I know our county is affiliated with the sheriff's office. Um, and but look at that, and but it is very county specific, absolutely. Um, and is it mandatory to show up each time? So all of them are going to have mandatory training. So once a month, usually like on a Wednesday night or Tuesday night or whatever, they're going to have mandatory training. You have to show up, and then they want you to be available during a disaster or mutual aid or call aid, and so. But they're flexible again. They're volunteers, so no one's gonna like come and look for you if you can't show up to a local disaster. But the trainings are mandatory. Does it matter if I volunteer at a nursing home or hospital? No, I think both of them are commendable places to be, and you know, different setting, different. Nursing homes are definitely going to be slower. You're going to be interacting with patients more, whereas hospitals, it's a big place, and you've got people coming and going, and so do whatever is going to make you happy, you know, and also you're going to get the big experience. All right. What if the clinic hospitals don't have volunteering applications? Should I go into a clinic and ask them for their volunteering option? Yeah. I don't know where you live, but I think and I don't know where this person lives, but most hospitals have some sort of volunteering, um, because they need volunteers to work the um, the gift shop and other things that they do, deliver flowers. So most of them do, and I don't know where you live. So if I know where you live, I could have looked for, because every place has a little bit different name for it. They also have like community representatives or something. Um, Out of scribing and biomedical research, what would be the most useful for med school admission? It's kind of saying, I want to win the Olympic gold medal in running. Do I become a fast runner, like a short distance, 100 meters, or do I train for the marathon? It just depends, like what you are interested in doing. If research is your interest, do research. If you want to scribe, you scribe. Again, it's one of those things that you got to decide for yourself. Like, you know, medical schools are not going to really care about. they're going to care about what you did, but it's what you followed your passion. If you're going to do scribing and you're going to be miserable, then do research. If you're going to do research and you're going to be miserable, do scribing. So, Lily asked, do you think taking a gap year before medical school would be beneficial to get? Yeah, I mean, I would just say that again, out of 168 hours a week, it's really hard to do everything. And one of those disadvantages of being younger, like someone who goes from high school to college and graduates, you haven't had a lot of experiences just because you're busy going to school and being a student. And so if you're non-traditional and older, you've done other things in your life that you could parlay into experience and leadership and those things. So yeah, and a lot of people get gap year. I mean, the average age for medical school now is 27. So that means that a lot of people that are older and younger, and so a lot of people have taken gap years. I just finished a medical assistant program. Is there any advice to get accurate clinical experience? I ask this because I feel insecure about if administrative experience fit as clinical experience. So, medical assistants have this dual role is to make sure that office and clinic works. And so, but also I would just say that in healthcare, I mean, doctors spend a significant amount of time doing paperwork. And so as a medical assistant, you're going to do paperwork. And it's, nobody's going to sit there and say, well, as a medical assistant, my responsibility was I was checking in patients, drawing blood, taking vital signs, taking simple history. That's clinical experience, but also doing the paperwork, creating a chart, updating the chart, doing the billing, all of those things. That's part of medical care. I mean, doctors sit for hours and code, and it's not coding a computer, but coding for medical coding so they could get built. And so don't feel insecure about it. I would just say get a job, start working, and do that. What experience do you need to become a medical assistant? Well, I would say CPR is the first one, and I know there's, like I said, there's training programs, but you minimally need to have a CPR, a BLS for healthcare provider CPR. Uh, if I want to become a physician, like a pediatrician, what kind of training would I need to do? Would shadowing a hospital be good career path? Yes, that you can become a court-appointed special advocate, volunteering at a pediatric clinic, volunteer, also a registered behavioral technician, where you work with a lot of autistic children. That's another really good experience that you could do. But again, like, what are you interested in? Like I had a friend who's a neonatologist, and um, she always wanted to do this because she had a little sister who died as an infant baby, and that always stuck with her. So all through college, she volunteered at the neonatal um, ICU. She also volunteered to hold babies that were born without mothers or that were addicted to drugs, and that's what she did to, all through college, and she's now a neonatologist. Where can I get volunteer for high school kids during Haran asked, where can I get volunteering for high school kids during summer? I tried many and geared was not getting it last summer. I would just say start early, build partnerships. I don't know if you are a parent or have a program. Partnering up with them, if it's a program, try to partner up with them. But the challenge with high school kids is that little tricky thing of being under 18 and being a minor. And so you're in a clinical setting. It's really, really challenging because as a minor, there's certain things they can't do with you. But also, if you get hurt, harmed, or anything else as a minor, there's a lot of layers. And and like, to be honest with you, there's also this worry of immaturity. Like kids are gonna take up his phone and start taking pictures or videos. So it's just really hard. And I don't know if you're a parent or have a program. I know like a lot of HCOPs that are for high school kids, they put the kids through this entire program of professionalism and get them HIPAA certified, give them BLS certification. So they work with them and they read them the Rare Act. So when they go to a place and say, "Hey, our kids are, past all of these things," they're more likely to do that. So again, Haran, I don't know if you are a parent that asking this or running a program. So, so is phlebotomy recommended or a good way to get experience? Yes, phlebotomy is a great experience. The other part about phlebotomy is that it can be flexible. Like a lot of hospitals have morning labs. So around 2:30, 3 in the morning to about 8 o'clock in the morning, people come in and draw bloods from everyone from the ICU to the floors to everywhere. And they called morning labs. And so I know some folks do that, and it's a great way to work for a couple hours a week. And then, if you're just one of those people that likes getting up early in the morning. Um, when you say don't recommend getting certified in MA classes, it said 2 years of career. I've seen shorter online program. I just want to make sure I understand correctly. So yes, so there are paid online MA programs, but they're just really, really expensive. And also, some states don't recognize that. So make sure your state recognizes it. Um, some a lot of states, some states don't. And so as long as they recognize it, but also they're really expensive. And pardon me, I have to keep drinking. My mouth is drying. So like I said, if your state recognizes and you could be certified, do it. But again, it's really expensive. Can you speak to path to clinical researcher? Yeah, so clinical researcher basically is um, a lot of people that have bachelor's degrees usually do it in their post-bac year. There's some undergrads that do clinical research, and basically, clinical research, you're collecting data. So you're, like, for example, in the ER, they have this thing called MRAP, which basically they have undergraduates, pre-meds, pre-nursing, that are in the ER and they look in the charts and push, they're doing a study on, I don't know, left-handed drivers that get into car accidents. This is just like something crazy and not real, but so basically you're there for a 4 to 6 hour shift. You look at the chart. This person got in a car accident. You show up with your clipboard and say, "Hey, sir, I'm my name is so and so. I'm doing your research. Would you be interested in being part of the research?" They first have to sign a waiver or consent. So you make them sign that form on your iPad, and then you say, "All right, great. We're doing the study on left-handed, left-handed uh, people with left-handed dominant hands that get in car accidents. And are you one? Yes, I'm a left-handed driver and I got in a car accident." And say, "Great." So then you go through your questionnaire and then you submit it and all that data is in there and you collect that data. And so that's what clinical research is. Other times they have to do blood draws on bloods to find different values and those things. And so um, again, a lot of them look for people that have bachelor's degrees. Some of them you could do it as an undergrad, but just doing a little bit of search. All right. I used to be a chiropractic assistant when I was both front desk and doing basic therapy setup for patient session. Is that counted as clinical experience? Yes. If you've touched patients and you've done it, then it's clinical experience. Is there a way to get? Yes, I will post them as soon as I'm done. I will post it as a PDF in there. I have to pick up a couple of medical related activities. Which one would you, out of all the activities you describe in this presentation, Lanuki, do what works for you and what you're passionate about. So I I can't tell you what is the best one to do, because we're all unique. Like I'm an EMT and I work in the ER. You ask me to go into hospice care or nursing home, I would literally like pick my veins and pick all the hairs on my body. I don't have any on my head, but I just couldn't do it. It's just very slow. Something I volunteer with is rock med. I love music. I love concerts. So I show up with my EMT and I help people and watch a great show. So again, these things have to be your personality and what you're fun. If you don't like loud places, probably volunteering at a concert is not going to be an experience that you want to do. And so again, um, do what works for you. Can DACA citizens who have work permit, are they able to volunteer at a hospital? So technically, if you're DACA, you don't even need to have work permit to volunteer in a hospital. It's only if you're working and getting paid. So nobody's going to ask you for your DACA status if you're volunteering. Most places now, next week things may change, but yes, I will post the PowerPoint into the chat after as soon as I just have to save it. So I'm sorry, Princess Akun is asking, sorry, I'm not sure if I missed it, but did you upload the PowerPoint or would you send it to our email? Thanks. I will post it in the chat. I promise you I will do it. I just need to answer all the questions and I'll post it. Raj, thank you. Session, can you have, yes, I will put the PowerPoints in there, guys. I promise. Is it better to be a phlebotomist or medical assistant? Would you recommend to do the best? So again, this comes down to phlebotomist. It's, the 80 hours you need to do. Medical assistant is a little bit different. You can be a medical assistant and not able to do phlebotomy. You could be a phlebotomist. There's another way you could get into a medical assisting job as a phlebotomist. Say, hey, I'm a licensed phlebotomist. Can I work as a medical assistant, non-licensed medical assistant? Again, do what's best for you. It's kind of like hard to say, do you want to be a marathoner or do you want to be a, Usain Bolt? Do you recommend shadowing with a single doctor or diversity of different doctor specialty? I think when you're with a single doctor, you build a relationship with them, but if you see them after, I don't know, 30 hours, it may get old and stale. But also, if you're seeing a single doctor, you're building that relationship, and it's good for a letter or recommendation, but also parlaying into other things. But also, if you're someone who's curious and you're like, yeah, I want to see if you're not in healthcare, it's really hard to say, well, what does a surgeon do? What does a dermatologist do? So that may be good. And if you have that option, do it. But usually shadowing is just a pretty hard thing to get. But if you're able to get multiple, you know, variety is a spice of life. How many hours of clinical experience do you recommend? I'm in my last year and we'll take a gap here and have almost 200 at a big hospital. And I was thinking spending time to do other activities like shadowing. Yeah, I mean, you know, uh, clinical experience. I mean, so I don't understand 200 hours was it volunteering or was it working in a hospital? And and shadowing, I mean, if you're already working in a hospital, if you're working and have experience, it's very easy to shadow a doctor. Like, I'll tell you this, like, as a ER tech, like, if I want to go shadow in the OR after work, you can't do it during work. You have to be off work. You could ask a doctor and go shadow him, and nobody, So again, um, you know, so yeah, so again, if you want to step back and do shadowing and do it. I don't understand the 200 hours. The 200 hours volunteering or 200 hours? Anyway, sorry. Where do I get the HIPAA certification? It's in the PowerPoint. I swear I will post it. You guys, here, I'm gonna do this because everybody is like chomping at the bit. Oops. Mm, People are like, shut up and upload this thing. So here, I'm gonna upload it right now. All right, it's uploaded. It's uploaded into the chat. So there's a link you could do HIPAA certification. All right, how do medical schools view summer research programs? Great, great. Do those. That's awesome. Apply to them. Hope you've applied to a bunch of them this summer. The other thing is if you're like doing a summer research program, some of them would have an option for you to shadow. Um, you could just reach out to people that you're doing research with, and so great. Yeah, some programs will tell you, please do not contact our physicians to shadow. Most of them do. And so you have this little thing called the badge, and you've been cleared, and you go in the hospital. So I hope that answered the question. I have no pre-med experience aside from prereqs courses I've taken. What should I consider applying for as a job to get my foot in the door and experience? You're located in Santa Rosa. I used to live in Petaluma, so I know where you exactly are. Um, I would say that look at Memorial Hospital, look at Sutter Hospital, that's there. There's also the Jewish free clinic that you can do. It's right off of Farmer Lane. I think it's Farmer Lane. Um, and um, and just start showing up and do that. I also know Memorial Hospital has scribes, so you could work there um, as well. And so yeah, I hope those answered the questions. Um, Gabby, are there specific you recommend for non-traditional older students since you mentioned it's not the same as pre-med in your 20s than it is in older non-traditional students? Yes, I mean, Gabby, I don't know what you've done in like what you've done as work and those things. I think older folks like us have superpowers. We have experience in life, we've done things in our life, and so it brings that difference to the table versus someone who's basically 18 has gone through high school and college. And so I don't know what those things are, but leverage those superpowers that you've done if you have worked in various things. So you could do it. And I wish I could like, if I knew more specific, I could tell you what but again, you've done things in your life and have those experiences, and those do matter. Where can I refer? I just uploaded the slides, people. I swear to God I did. If you've not, can you guys thumbs up or thumb down if you have seen the slides in the chat? Okay. All right. There's a summer volunteer program. Um, there's a summer volunteer program where you will go with the team for 1 month to help serve the community. What do you think about it? Or should someone more consistent to do research this summer? Again, if those are those medical tourism or medical, I would be really apprehensive because they cost a lot of money. But also, there's this huge issue with it that if you go to a place and do it, now I know that like I've actually gone on a team. I'm a trained licensed professional, and so I could do things. And so the group of surgeons go for a week to an underserved area and provide free surgeries and stuff like that. Those folks have a skill that's needed. You as a pre-med student that is not certified or licensed in anything, going somewhere to do it is just like, well, you can do it in your own home, so you're doing it here. So again, you have to do what's best for you, and so summer research programs are great opportunities. No question. Thank you for helpful. Great. I have a license phlebotomy, but I have a hard time finding part-time per diem jobs while being a full-time college student. So I don't have a car, so commuting time is a lot. So I don't know where you live, but I know a lot of hospitals hire per diem and part-times. And again, this is a hard, challenging thing to do, but also the insurance, becoming a phlebotomist for insurance companies. But again, if you don't have a car, it's really challenging. Um, and also, look at clinics too. Community clinics do have phlebotomy and lab, and so look at that as well. But you're right, school is your number one priority, um, and definitely take care of that. Being a caregiver from clinical experience, yes, I mean if you're like, changing wounds, blood pressure, and other things, it's considered clinical experience. Um, and so definitely it does. But I would say if you're doing all that stuff, just become an EMT if you can, or get some sort of certification um, that you can have as well. Um, does doing shadowing and volunteering at Women's Cancer Center? No, well, volunteering again, as volunteering, you're not providing clinical experience. It's mostly uh, it's not, again, it's not direct patient care experience. You're volunteering in a women's clinic. You're probably helping with transporting patients and stuff like that. So again, it just depends what you're doing, and so I can't really like if you could tell me what you're doing, then maybe, and also how you write it on an application is really important. Um, did you look in the chat, you guys? The webinar chat? Hold on, let me do this again. I'll do it again. Okay. All right. You see the slides. Perfect. All right. Your chat is disabled. You should be able to see it. Okay, you've downloaded the slides. Amen. Amen. Okay. Yeah, so again, okay. I'm volunteering at a children's hospital for providing activities for children during their wait time before their appointment. Does this count as volunteer? Yeah, that's volunteer experience. It's not clinical experience. Um, but also look if your place has life child specialist and Raj. What I'm going to do is I'm going to email the slides to everyone that signed up. So this way, um, sorry, I will I will email everyone that signed up. So I'm volunteering at a clinic, hospital providing, yeah, for children's, yes. So absolutely, it's volunteer experience and it's a great experience, and it's also maybe you could ask one of the doctors if you could shadow them. So yeah, it's great. You're in, you have a badge. It's volunteer experience, but you could, do shadowing and maybe find other ways to be involved. All right, guys. It's been 2 hours and I'm about to pass out. Just just kidding. But I hope this was helpful. I will email the presentation to everyone, and hopefully I will do it right now so everybody will have it. And thank you for everyone coming and hearing me. Hopefully this was helpful and helped you in your journey. And yeah, so all right. Well, you're welcome. I'm glad that it helped. And like I said, I will both email the PowerPoint, but I will also put it into the web page that um, you guys signed up for this thing. I'll put that on there as well.